Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location at El Haje Dental in Washington, D.C., discussing effective dental treatment options that can restore your smile and improve your dental health with one of this region's top prosthodontists, Dr. El Haje. Dr. El Haje received his DDS degree from Northwestern University in Chicago, Illinois, and was a former assistant professor in prosthodontics at Northwestern University. He did his residency in both TMJ Disorder Management and prosthodontics from Georgetown University. Dr. El Haje has also completed his fellowship in oral implants at the University of Pittsburgh and is widely renowned around the world in this field and has been a lecturer in prosthodontics, aesthetic dentistry, implant dentistry, and TMJ management. Welcome, Dr. El Haje.
How are you? Thank you for coming.
Oh, it's our pleasure to have you on. You are so well known within your fields and your specialties, and certainly are one of this region's, if not one of this country's, top prosthodontists. We have a lot to talk about. We've got patients coming up a bit later, but I wanted to begin, Dr. El Haje, by asking you if you can please tell us what are some of these effective dental treatments that can help us in so many ways.
Usually effective dental treatment varies from one patient to the other. That's why in the first appointment we do a comprehensive exam to see what the patient needs, and then we customize the treatment to fit the particular patient's need. So if the concern is missing teeth, it's different prosthetic options going from as low as dentures, removable, to implants or crown and bridge. If this aesthetic concern, we talk about various types of veneers and lumineers that can cover the area of concern.
Now, how long do some of these treatment options take? And I want to put in the disclaimer that, again, I'm sure it varies depending on how much work is needed, and what type of treatments that patient is going to get. But in general terms, what are people looking at, for instance, with dental implants?
Again, dental implants, it depends where, in which area the implant is placed, and usually it's around 6 months
over
to place the implant, and then another 1 or 2 months to put the prosthetic part of it. First, we have to place the implant on the bone, and once it heals correctly, we have to build on top of it the tooth. But again, this is rough estimate. It depends on the bone quality, the chewing habits of the patient, and the amount of forces that will be on this implant.
And what about with some of the other treatment options?
Most of people in the East Coast, and especially in the DC area, they have what we call parafunctional habits, which is habits that meaning in layman's term that it's habits that are not good, like clenching, grinding, even if they don't know it, because most of these habits happens at night. So not every patient can do it, but the dentist, when we look at the teeth, we can see patterns of teeth wear, or we see some clicking in the jawbone that tell us that there's something happening, overloading the oral structure from teeth and joints.
Yes.
Again, and this varied from the most simple treatment for it is a night guard to protect the teeth at night. Yes. So when you rub against softer material, not against too hard subjects that will cause wear for the teeth.
Sure.
And
it protects from the grinding, as you just said,
at night.
It
protects the teeth.
Yes, it protects them because
While
it's in between.
It will not stop you from grinding, but it will protect your teeth when you grind.
From the wear.
It's like if you are traveling with your car, you have glass, you better put foam in between so they don't break the glass. The same with the teeth.
That's right.
The teeth will be knocking at night, or if they have clenching or grinding, then they'll be overloading the tooth structure, which is made almost like porcelain, the enamel of the tooth, and can fracture. So when we spot, now if the problem is joint problem from pain, then we move to TMJ treatment, which means the temporomandibular joint treatment, which is the joint that articulating the lower jaw to the skull.
Okay. And there are quite a few people that have these TMJ disorders. They're not aware of it in many cases because it's not right there in our mouth necessarily, right? As far as our teeth, it can be in different parts of our head, as you just touched on. And then we find out when we come to a specialist like yourself, who also is very esteemed within TMJ disorders, in addition to implants and aesthetic dentistry, among other specialties, that someone has that disorder, and then what would happen for somebody with TMJ, doctor?
Yeah, unfortunately, teeth are not, they don't present themselves like stomach pain or hand pain. My stomach hurt today, or my arm hurt today. Tomorrow it's good, that means everything is okay. Yeah. Teeth are protected mainly by enamel, which is very hard substance that normally, if everything is healthy and the gums are healthy, you will not feel anything. With teeth, if you experience any sensitivity, it's sign of something that need to be taken care of. If it's pain, it's more advanced, and unfortunately, it's more signs that further treatment like root canal therapy and things like that will be needed. Okay. That's why it's very important to address any defect prior that present any type of symptom, or once it presents any type of sensitivity.
Yes. And as far as aesthetic dentistry, cosmetic dentistry, in other words, with the porcelain veneers and all the benefits of enhancing our smile that are now available due to advancements in technology, from what I understand, that new smile now is a very natural looking new smile. You don't look like you were done, in other words, with some of the technology that's made that possible, that has taken place as far as advancements within cosmetic dentistry.
When it comes to cosmetic dentistry, it's another type of treatments. There is functional treatment, which is something breaking down and we have to restore it. And this is basically, it's standard type of care, and usually I feel that the dentist should have 99 control of it. It's like building a building. To put the foundation, the architect will take care of it. Yes. But the aesthetic part of it, you can get 90% of it from the person want to build the building, in this case, the patient. Yes. So I usually give the patient control over 90% when it comes to aesthetic. Because will be the one looking in the mirror, right, and he have to like what he's getting.
That's right.
So the input usually is more toward customized toward what a person think he want to look like. Yes. Now, if this clashes with the functional part, I will try to steer him toward the limitation of everything, so things can have the best success.
Yes, indeed.
But when it comes to aesthetic, it's basically I ask, what's your complaint, and what do you think you want to look like, or your smile should look like.
So you really listen with both ears, a lot of feedback from the patient to customize the right cosmetic dentistry solution.
Absolutely. As I always say, when it comes to function, I tell my patients that I have 99% of the control.
Yes.
But when it comes to aesthetic, they have 99% of control over what they think is best for them.
As far as the results from these different treatment options, whether it be implants, whether it be cosmetic dentistry solutions, whether it be night guard or other treatment options that you've discussed here today to educate us on various effective remedies available for us, what kind of results can we expect?
Again, in anything in life, common sense is very good, even in dentistry and everything. It all depends on two things: how good the product was done and how good you maintain it. Yeah. So it's the dentist's obligation to do the best he can do, But after that is the patient's obligation how to maintain it with good oral hygiene, coming in regular cleanings and things like that.
Yes.
So.
And that's something they have to do regardless whether they had a dental treatment or not.
That's true,
something you
yeah.
should always look to
It's
uphold
better
as
to
you
look
go
at
through
things
life.
before they happen, yeah.
That way it's a proactive approach instead of a reactive approach. Especially when you've had a treatment option like you've discussed here today done, we should listen to the doctor.
Most of the time.
Yes, yes. We're now going to meet some patients of Dr. El Haje. Welcome, Dr. Contract.
Guys, nice to be here.
Well, it's our pleasure to have you on. Not only are you a patient of Dr. El Haje, but you're also an orthodontist right here in Washington, D.C. And I wanted to begin by asking you, how long have you been coming to Dr. El Haje?
Well, I've been a patient for about a dozen years, and happen to have my office in the same building.
You guys are just a few floors apart.
A few floors apart.
All right, so you've been coming to Dr. El Haje for quite some time, obviously. And what types of treatments have you had done over the years with him?
In the beginning, it was cleanings, checkups. I've had a bridge done to replace an older bridge. Teeth were chipped and discolored, and I had lumineers done to cover up a lot of the parts of the teeth that didn't look that nice. And now I have a smile that I'm almost proud to show.
Well, I'm happy to hear that. So that's one of the various treatments that you've had done over the years, and you certainly feel better with the lumineers because, like you just touched on, Dr. Contract, you have a smile that you're proud of again.
A funny story, I have patients that come see me to have their teeth straightened, and they'll look at my mouth as I'm speaking, and they'll say, I want my teeth to look like those. So that'll tell you something about
That's right.
how my teeth look.
Well, that says it all right there, in fact. Now, as far as the viewers that are out there watching, what would you tell them about Dr. El Haje and his staff here?
Oh, Dr. El Haje, very knowledgeable, very gentle, and the treatments tend to come out very, very nicely. The finished results, I've seen quite a number of them. And the man is verging on being a genius.
Well, I'll tell you what, that speaks very loudly, especially coming from not only a patient, but an orthodontist who himself is very esteemed in this area like you are as well in your field. Lastly, I wanted to ask you, you're pleased with the results. It speaks for itself, what you've told us thus far. And for the viewers out there watching, would you recommend them coming to Dr. El Haje?
Oh, I would indeed. I don't think you can find anyone who is going to give you a nicer result. I really don't.
Well, on that note, I'd like to thank you, Dr. Contract, for coming down and sharing your experience with us from the patient perspective as well.
Thank you.
Thank you. Welcome, Alonzo.
Thank you.
It's our pleasure to have you on as well. We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, I wanted to begin by asking you, Alonzo, how long, first of all, have you been a patient of Dr. El Haje?
Oh, since 1999, so it's going to be 13 years.
My goodness, a long time. Just like Dr. Contract is a patient of his that we just interviewed a few moments ago. Now, as far as the various treatments that you've had done over the years, can you give us an idea on some of them?
Yeah, well, I have a really bad teeth, so I had to be under several treatments, and mainly, I would say, well, several bridges. I have 4 new bridges. So it takes a lot of time to do.
Yes.
And you know, you cannot do it all at once. So yeah.
So you've had multiple bridges
Yes.
over the years.
Yes.
Any other types of treatments that stand out?
No, basically those. Yes.
Those.
Yeah.
So a lot of bridge
But,
work.
yeah, but that is a lot of work as well.
Yes. Yes, it is. And as far as your experience with Dr. El Haje and his staff over here, what can you tell us about that?
I think it's been a very good experience. Otherwise, I wouldn't be with him for so long.
That's right.
He's always very attentive, very helpful. When there is an emergency, he's always ready to help.
For the viewers out there that are watching, what would you tell them?
I would tell them that they should feel safe when they come here. They will be well treated. Dr. Emad is very honest and very transparent
Yes.
when he talks to patients.
Yes.
And so you will know what is going on, and he will tell you exactly what happens.
Well, that's certainly good to know. And on that note, I told you it'd be painless. Thanks for joining us, Alonso.
Thanks too.
Welcome, Arthur.
Thank you. Thank you for having me.
Oh, it's great to have you on as well. And I wanted to begin by asking you the same question that I asked the other two patients, and that is, how long have you been a patient of Dr. El Haje?
For about 11 years now.
My goodness.
Yes.
All three of you have been with him for double-digit years.
Yes.
And what are some of the dental problems that he has corrected for you, some of the treatments that you've had over the years, just so we have an idea?
Well, he's done my cleaning, but the main project that he did for my teeth was I had a chipped tooth in the front, the front tooth, and he put on a cap on it with veneer. So that was the treatment that he made. And usually this treatment involves, I think, 2 veneers so that they can match, but I wasn't able to afford so much, so he just did 1, and he was able to find one that really matched the color of my tooth.
So it's a very natural looking color or shade. One can't even tell by looking at your smile that you've had that done.
Thank you, I agree.
And I think that's always most important, because a lot of folks, you know, when they think of a veneer, for instance, something along the lines of an aesthetic or cosmetic dentistry, they automatically think, I want that real bright Hollywood smile. They don't realize that actually, and Dr. El Haje, you know, this is something he's touched on as well, that you want to listen to the patient, and you want to give them a solution that's best for them, customized for them, but at the same time, one that looks very natural, as opposed to looking, you know, not natural.
I agree, and definitely I think this look was very natural.
Well, that's good to hear.
Yes.
It certainly looks good, like I said, Arthur.
you.
And as far as your overall experience over the years with Dr. El Haje and his staff, what would you tell us about that?
It's been very good. He gives me a lot of attention to my teeth, especially because of the work he did with the veneer. And his staff has been very good. I've been very happy with the service here.
And you're very happy with the results, obviously.
Yes, I am.
That's great to hear.
And I've recommended him to others as well.
Oh,
so.
I think that says a lot right there.
Yeah.
And on that note, I'd like to thank you, Arthur, as well, for joining us and being a guest on our program.
It was a pleasure. Thank you.
Our pleasure. We're now back with Dr. El Haje. The patients very pleased with the results. And what I found very interesting was you even had an orthodontic patient, Dr. Contract, who's been a longtime patient of you, speaking so highly of your work, because that says it all when it's you know, a fellow professional within your industry.
Yeah, thank you.
Some very good work indeed, doctor. How long do some of these results last? Let's look at dental implants in cosmetic dentistry with the porcelain veneers, for instance. After they've been inserted and the treatments have been completed, what kind of long-lasting results are we looking at?
Everything depends on how good they were done and how the patients maintain them. If and providing that everything placed in the mouth have to be the best the ability the dentist can do. After that come about the chewing habit, the maintenance of the patient that will make it last longer than.
Yeah, so you're looking at
Plus,
many years, I'm sure, if
there
it's
is
maintained.
many years, but as you know, if whatever the good Lord gave you does not last you forever,
That's right.
I can assure you, whatever any dentist does, no matter what his ego is, will not last forever. But having said that, things usually are expected to last in the area between 5 to 20 years.
It's a long time.
Depending, yeah, on how they are used to.
Yes, which makes sense. In other words, like you said earlier, as long as they're coming in every 6 months, like they should anyways, whether you've had a treatment or not,
and as long
good oral hygiene, things like that, then you're looking at very long-lasting results, particularly with the dental implants and the porcelain veneers on the cosmetic dentistry side.
That's true, yeah.
Now, we've only got a few moments left, Dr. El Haje, and we're certainly found from our research on your practice and yourself not to mention the patients we've already interviewed earlier. You and your staff really seem to care, and I don't mean that as a cliche, but you really seem to treat everyone as if you would want to be treated as far as patient care and going that extra mile to make sure your patients are taken care of and very happy.
That's true, and I think this is what basically when you try to do the best you can do and to do what you expect doing to you when you are in the dental chair, I think the best results come true.
And I think that's very important because you know as well as I do, and millions of folks out there as well, that going to the dentist is one of our biggest fears. It really is. It's not far from death and taxes. So to have a dentist who's very easygoing, relaxed atmosphere, soft-spoken, and obviously with a very strong reputation like yourself, for instance, and the staff that really takes care of the patients as well here, I can see where the patients get very comfortable and that fear is eliminated in many cases. That a lot of us have, because I mean, really, from what we found in the patients earlier, as I mentioned, very pleased with the results and the patient care here.
Yeah, we try to do our best.
Yes, indeed. And on that note, I'd like to thank you, Dr. El Haje, for joining us and being a guest in our program. Very educational, covered a lot of different treatment options that are very effective, that you specialize in, that are available for folks out there. And thanks again for joining us and being a guest. We'd love to have you back in the future.
Thank you very much for interviewing.
Thank you.